Good afternoon, everyone, and welcome to the University of Manitoba Alumni and Friends Virtual Learning for Life Fall 2020 series. My name is Tracy Bowman. I'm the Director of Alumni Relations here at the University of Manitoba, as well as a proud UM alumna, and I'm today's moderator for the session. So thank you for making this part of your day today. We really appreciate it. We've been able to make this program free of charge to all of our 148,000 alumni living in 140 countries around the world, thanks to the very generous sponsorship of one of the UM's affinity partners, IA Financial Group. Many thanks to them. Delivering learning for life opportunities is certainly a very important role for the University of Manitoba, and we are proud through programs like this that we're able to feature so many of our leading researchers and professors. So just a few housekeeping details before we move forward. You're all viewing this in YouTube. We will also be sending you a link to this session afterwards if you'd like to see the recording. Just a reminder, if you'd like to ask our speaker questions at the end of the session, please go to the platform Slido. That's www.sli.do, and the password is VL04. We will continue to remind you about that at the end of the session and during the Q&A. We will do as best as possible of a job to answer all your questions. I know last week we were unable to ask all the questions. There were so many. So please do add as many questions as you'd like, even follow-up questions. I'll do my best to ask them all of our speaker today. So now I'd like to introduce today's speaker, who is Dr. Verena Menec, and she'll be presenting on the topic social isolation and loneliness. Why are they a public health risk, and what are the possible solutions? Now, let me tell you a little bit about Dr. Menec. She is also an alumna. She's a three-time alumna of the University of Manitoba. She's also a professor in the University of Manitoba's Department of Community Health Sciences in the Rady College of Medicine. And she's also formerly the director of the Center of Aging here at the U of M. She has served on many advisory committees, including the advisory board of the Canadian Institutes of Health Research, Institute of Aging, and the board of Canadian Sociology, the board of Canadian Association on Gerontology. Dr. Menec's main research areas are in the 8 areas of healthy aging, determinants of healthy aging, social isolation and loneliness, and age-friendly communities as a way to promote healthy aging. She's been a recipient of many research grants, including the Canada Research Chair in Healthy Aging, and she's also the Manitoba site lead of the Canadian Longitudinal Study on Aging, which is, and this is very interesting, the largest study on aging ever conducted in Canada that will follow approximately 50,000 men and women between the ages of 45 and 85 for at least 20 years. So with that, over to you, Dr. Menec.
All right. Thanks, Tracy, for that introduction. And I'm delighted to come to you today from my home. So hopefully it'll be relatively quiet behind me. I will be talking about social isolation and loneliness. I've been working in this area for some time now. And so I'll give you a little flavor of what that work has involved. Let me just give you a brief overview of what I'll be talking about. First of all, I want to talk about what we mean by social isolation and loneliness. Then I want to go a little bit into how common are they? What do we know about that? Then into the key question, why are they public health risks? Then I'm going to make a little detour into COVID-19 because it's hard not to talk about COVID-19 these days. And then I will conclude with possible solutions to alleviate social isolation and loneliness. Now, first of all, I just want to make the comment that, of course, an older adult, which is the focus of my research, is not the same as any other older adult. So they're not all the same. There's a lot of heterogeneity. We have an enormous age range. If we talk about the typical cutoff of 65 plus, we might have a 40-year difference between that 65-year-old and a 105-year-old, which is not that uncommon these days. So there are health differences. There are active, younger, older people. There are people with a lot of health problems. People have money, so high income versus low income. So all these factors are important to keep in mind, and they will keep coming back in my presentation, as you will see as I go along. So what do we mean by social isolation and loneliness? Well, social isolation is typically defined as an objective situation. So it's the objective state of having no social relationships, so no people in one social network, or having a small social network, or having limited communication with the social network. So an objective state. On the other hand, loneliness is a subjective experience. It typically is defined as an unpleasant experience that results from the perceived mismatch between who we have in our relationship network and what we want. Now, let me go a little bit more into detail to make this a little clearer. So, first of all, with social isolation, imagine yourself at the middle of three circles. In the inner circle around you are the people that are closest to you. And imagine those are the people it's really hard to imagine to live without. Often these are family members, they might be a partner, so a spouse, and so on, but it could be a friend. It doesn't really matter. So these are really important people. In the next outer circle are the people that you also feel close to, but they're a little less important. And then on the outer circle are other people that are also important, but again, not quite as close to you. So let me give you a couple of examples. So take Elizabeth. Elizabeth, when you look at her social network, there are a lot of people there. There's a husband and son, daughter, sibling in that inner circle. So these are super important to Elizabeth. But then there are also other people around her. Contrast that with John beside her, and in just glancing at it, it's a rather sparse social network. So there's no spouse, for one thing, no partner, nobody in that inner circle. So maybe John lost his wife, lost a partner. There's nobody else in that inner circle. On the outside, the middle circle, there's maybe a neighbor, and then outside we have another neighbor and a son that he is not really close to anymore. So very, very different social network patterns. Now, here comes the tricky question. Who is socially isolated? Now, if you look at the comparison, you probably say, well, of course, Elizabeth is probably not socially isolated. We could probably agree with that. But then what about John? Is he socially isolated? Probably, but it kind of depends on how you look at it. So are three people not enough? Is it two people, four people? In other words, where do we draw the line? And that's a really tricky question. And many researchers have answered that questions differently. So we have different definitions of social isolation because researchers draw the line at where you become or where you're classified as socially isolated in different spots. Now, what about loneliness? Is Elizabeth likely to be lonely? Well, she's got a large social network. That doesn't mean, though, she is necessarily not lonely. So in other words, one can have a relatively large social network, but still feel lonely. It is a perception. On the other hand, John, socially isolated, let's call him socially isolated. He might actually not feel lonely at all. He is just, he's one of those hermits. Well, I'm okay without having anybody around me. So the loneliness, again, can go along with social isolation. There is a correlation, but the correlation is actually quite low. So one can be lonely in a crowd, or one can be not lonely and socially isolated. So I'm spending a bit of time on this because then the next question is, how common are social isolation and loneliness? And again, it depends where we draw that line. Who do we call socially isolated and even lonely? Like, how lonely do you have to be called lonely? Is it once in a while? Is it all the time? Again, it depends, the research depends a bit on where, actually quite a lot, I should say, on where that line is drawn. Now, in our research, and this research is based on data from the Canadian Longitudinal Study on Aging, which is a national study, we estimated how many people are socially isolated or lonely. And in terms of our definition, we have used a rather stringent definition. In other words, we would say John is socially isolated. There's quite a restricted social network. So what we find is that about 8% of Canadians aged 65 plus year old are socially isolated. And if we translate that out into numbers, that's around 550,000 older Canadians. And that's, of course, an approximation. It's rounded. We also find that about 11% of older Canadians age 65 plus report being lonely, and that translates into about 750,000 people. So that's quite substantial. Again, it's in the context of having quite stringent definitions. If we are a little more liberal, if we draw that line a little in a different spot, those numbers would double. So there's another 8 or 11%, give or take, of Canadians who might be called also potentially socially isolated or lonely, or at least at risk of social isolation or loneliness. Now, an important thing is, and it gets back to the beginning of what I said, people differ. So social isolation and loneliness are more common among certain groups. And I've given a couple of examples. So for example, social isolation increases with age. So when we look at those 75 to 85-year-old, we have 10% of Canadians that are socially isolated, again, using our rather stringent definition of social isolation. And strikingly, we have 1 in 3 men who are widowed who report being lonely. So that goes then up to 33%. So overall, while we had that 11%, we're now at 33%. So it varies tremendously across dimensions, personal characteristics. So why are social isolation and loneliness health risks? Well, they're related to many, many health problems. And we know a lot about that from a lot of research over many decades. So this is very well established that both social isolation and loneliness are risks to both physical and also mental health. And I've just given a few examples here. So we have physiological impacts like decreased immune system function, worse sleep quality, but also health behaviors like people who are socially isolated are more likely to have to be less active, to have poor nutrition. And then we have a series of health issues like increased risk of heart disease and stroke, increased risk of dementia, the risk of depression is particularly strongly related to loneliness, poor quality of life, increased healthcare use, and increased risk of mortality. And there is more. So to give you an example for, again, this is based on Canadian Longitudinal Study on Aging data. We were looking at Canadians aged 65 in this case, and psychological distress. Psychological distress is a combination of both depression and anxiety. So when you look at those who are not lonely, and in fact, actually not socially isolated, 9% are psychologically distressed, which tells us that it's not all about social isolation and loneliness. There are many other factors why people feel distressed. However, when we look at those who are lonely, 25% were psychologically distressed, and that increases to 30% for those people who are lonely and socially isolated. So the evidence that social isolation and loneliness are major health risks is so strong that in one analysis, and a meta-analysis of many, many studies, the authors concluded that the influence of social relationships on risk for mortality is comparable with well-established risk factors for mortality, like smoking, like lack of physical activity, like nutritional factors. So it is a very consistent finding across many, many studies. Now here it gets complicated. What comes first? The chicken or the egg? Does social isolation or loneliness result in physical and mental health problems, or is it the other way around? And it's actually both. So social isolation and loneliness both predict poor physical and mental health outcomes, but physical and mental health is also a predictor of social isolation and loneliness. And it's a whole lot more complex than that. Now, here on my slide, I've just made up an example. This is just to illustrate the complexity of issues. This is not based on specific research. It's just kind of hypothesizing about how these many factors and relationships could work. So let's take somebody who has lost a spouse, became widowed, like I mentioned, like perhaps John, who lost his wife, becomes socially isolated, doesn't eat very well anymore, doesn't sleep well, starts to get depressed. Loneliness also sets in at some point, starts to get less active, and we have perhaps existing problems, physical health problems that get worse yet. The loneliness gets even worse, and we have a cascade of problems that make him spiral down into even worse health, both physically and mentally. We can also imagine that at some point, if we were to intervene, we could have a spiral back up. So perhaps we can get this individual to be a little bit more socially engaged, a little bit more active, then sleep might improve, nutrition might get better, so the person might eat a little better, might feel less depressed, and we start to see health benefits happening. Now, here's my detour into COVID-19. As we all are more than aware of, March 19, this was a March 19 cartoon. In March, COVID hit, not just in Manitoba, but elsewhere. Before that, in other countries. And of course, that has had an enormous impact on our lives. Just like I am now doing this presentation online. Normally it would be in person. So we have gone from being able to be with people to being at a distance from people. And when you are like me and you look at the picture at the top, it almost seems weird. There are people who are close together. We don't see that anymore. And if we do see it, it's not what should happen. So in June, my team and I, we conducted a small study in Winnipeg just to find out how this COVID situation was impacting people's social lives. So did it affect their loneliness? Did it have mental health impacts, their social participation? And if you remember back in June, this was just after we had ended our lockdown. So we were just coming out of that lockdown that started in March. We were moving into a time when we thought we were okay. Of course, now we know we are still not okay. So we asked people, among other things, whether they felt lonely or depressed prior to COVID. So we had to actually ask them to reflect back. That's not so ideal, but we had to do that just because of the way there was no other way to do it, let's put it that way. So prior to COVID, people said 11% of participants said they felt lonely. If you recall, that was exactly the number we also had with using Canadian Longitudinal Study on aging data. So that gives us kind of confidence in our data. So that's a nice way to confirm that we're not that far off with our study, with our small study in Winnipeg here. People said that 23% of the respondents said they had felt depressed some of the time. And then the change during COVID. So we asked, well, now during COVID, how are you feeling? And 31% said they felt lonely, and 58% of respondents felt depressed some of the time. This does not probably surprise us, because then and also now, these are very, very stressful and emotionally difficult times. We also did focus groups. So the first part was surveys, but this we followed that up with focus groups. And what was quite evident was how important staying socially connected was, and how many people moved to that online platform that, of course, we are right now also taking advantage of. So in terms of this quote from a focus group participant mentioned how activities moved to Zoom. And but that it was also a social. It's not just a physical activity, but it was also very much of social importance. So we think, of course, and I've shown a little bit of evidence that, not surprisingly, COVID has had a major impact on people's lives. What we don't know, though, and what are some really important research questions, is what are the longer term impacts of social isolation and loneliness on mental and physical health? We did our study in June. I wonder what people are like now. I don't know. Is the impact different for different groups? Who is most at risk? And that is a really key question that gets us back as to the most vulnerable people. And those are people who are on low income. They're not online. That online presence has really helped many people, but many people don't have computers. Many people don't have internet access. And we've now heard in Winnipeg, some of the most vulnerable people, they don't have phones. So these are people who are really going to be suffering the most. So what is the impact going to be? And one interesting question is, can online social interaction compensate for lack of in-person interaction? And importantly, for how long? How long can we maintain mental health, for example, as we are online? Now, we're going to be able to look at some of these questions with the Canadian Longitudinal Study on Aging, which I've been referring to several times already. So CLSA has added a COVID study, and we have many participants who have been participating in this add-on to our normal data collection with questions around not just COVID itself, but also mental health and exposure and loneliness and that kind of things. If there are any people in the audience who are participants in CLSA, I just want to send an enormous thank you to you. We absolutely are so grateful to your participation in the study. All right, that's a bit of that background, the impacts. Now, what about solutions? Well, if social isolation is about increasing social contact, if about a lack of social contacts, I should say, then, well, we should just increase social contact. And if loneliness is about a subjective experience of that somehow the quality of the relationships are not, don't meet needs, then we should enhance the quality of social relationships. Now, that's, of course, extremely simplistic. Because really what we need to understand is, why are people socially isolated or lonely? And by knowing that, we can start to tailor programs, interventions, solutions to specific needs. I've already talked a little bit about some of the risk factors are, but let me add a few more. We know that certain groups of people are more at risk of experiencing social isolation or loneliness, or both. For example, I've already pointed out older age is one risk factor, but also we know that low income is. It is harder for people to connect with others when there's no financial means. Another example in that category would be caregiving. Being a caregiver can be very isolating and lonely. We also know that certain life events and transitions can lead to social isolation or loneliness, and losing a spouse, a partner is a big one. So becoming widowed is a very, very big one, but also retirement, where one loses one's social network, can be another cause, another factor that then creates social isolation or loneliness. There are also personality differences and psychological responses that can be important. Some people have different expectations of relationships. They have sometimes unreasonable expectations of relationships, that relationships should always be perfect. Sometimes people are too shy to make contacts. There may also be real psychological problems like social phobias. So that makes it very hard for people to reach out and make contact with others, even though they may very much want to do so. Health-related factors are important, and that I certainly alluded to earlier. So people with, for example, mobility problems may find it difficult to get out, and therefore their social networks shrink. So they can become socially isolated. And then there's a broad category of what I simply called environmental factors, and that might include things like lack of transportation, so not being able to get around, not being able to access the programs and services that are actually out there. There's may also be a lack of programs or services in a neighborhood, so it's just nothing available. And then in Winnipeg, we're particularly familiar with the winter, which can also create social isolation and loneliness, particularly if it then gets coupled with other issues like lack of transportation or health problem, mobility problems, and so on. While I'm talking about solutions, I also want to say at this point that the idea is not to make everybody into social butterflies. It's not all of us want these large gatherings around us. Some of us are introverts, and we're okay with that. So the solution is more to meet the needs of the individual person. So maybe one person will want one significant other, one friend, and that's the only person they really want to interact with. Maybe you should have a few more, but it's a small network that the person's looking for, and another person might want those big groups, those large gatherings. So let me tell you a little bit about a project I'm currently involved in, which is trying as its overarching goal to improve the social inclusion of vulnerable older adults in Winnipeg. The terminology here is social inclusion, but think of the opposite. It's trying to reduce social isolation and loneliness among older adults in Winnipeg. It's a collective impact project in the sense that it brings together various organizations, because we recognize that no one organization can deal with social isolation and loneliness on its own. It needs to have that combined effort of many organizations. The key organizations that are part of this are A&O Support Services for Older Adults, A&O, which is an organization that has a number of programs for what I would call more the at-risk older adults. So social programs, but also elder review program, for example, and so on. Active Aging in Manitoba is another partnering organization. They focus more on the physical activity or the active living side, as the name implies. So they have exercise programs. They also have the 55+ games. The Manitoba Association of Senior Centers is an umbrella organization for to promote senior centers, or what they're now called active living centers. Transportation Option Network for older adults, as the name suggests, it focuses on transportation, but is an educational, informational type of organization, so does not provide transportation itself, but hopes to make transportation for older adults better. And then I'm involved as part of the with my for the UFM with that component I'll briefly mention later on. And then, of course, it takes many partner organizations to actually truly improve the social inclusion or reduce the social isolation and loneliness of older adults, as our goal is. So what are some solutions? One is that some people don't know what activities are out there. That is an ongoing issue. There are a lot of social types of activities, anything from exercise, and I'm going to call that a social activity because it all involves a social component, typically involves a social component, to anything from social groups, going out to movies, the opera, what have you. There are many, many groups, but some people are not aware of that. And so one aspect of our project is to try to promote activities and the organizations that participate in different ways through the radio, newsletters, newspapers, and so on. And perhaps the most effective way to get information out is actually word of mouth. So we hear it from other people. So that's kind of, in a way, a simple yet difficult solution because sometimes it's hard to reach. Another possible issue is that people feel uncomfortable joining activities. So the Manitoba Association of Senior Centers is going to work on trying to make active living centers for older adults more welcoming. It does not mean they're not currently welcoming, but trying to make it even better and more inclusive. It is very, very hard if you're already socially isolated or feeling very lonely and perhaps quite vulnerable to walk into a place and there are people there who know each other and you're the new person. So having a buddy system or having somebody then come to the door, there's a new person coming in, having somebody there who greets them, who shows them around, who introduces them, could really alleviate that feeling of discomfort. Lack of transportation, we know, is a big issue, not just in Winnipeg, but in many, many places and throughout Manitoba and elsewhere. So the transportation network for seniors, TONS, is looking at creating some organizing, coordinating volunteer driving better than it is currently. And then that would hopefully, by having a better coordination, having more volunteers involved, that would enhance people's ability to access services. A number of programs for older adults also already provide transportation, and that is key, and that could be promoted as well. So what about the people with the physical health or mobility problems? Some people simply can't get out. So one option then is to make activities available in a variety of ways. And one of those ways is over the phone. Currently, of course, given COVID, we're very much aware that we are online a lot these days, and that's great for those people who have computers and have internet access, but it's not solving the problem of social isolation, loneliness for those who don't have that. So A&O, and I'll give you some examples here. A&O has had for quite some time, actually, the Senior Center Without Walls program, where people, and this is a free of charge program, can call in for all kinds of sessions and programming. And with COVID, that Senior Center Without Walls program has, of course, come in really handy. It's already established, and they've been able to expand it and provide more sessions. So the current sessions, or just upcoming ones, are taking care of your mental health, which is clearly important, but also something like walking the Camino de Santiago. So it's Celtic Christmas music. So it's a wide variety of offerings that are given over the phone for people who are socially isolated and homebound, and also people in rural areas where sometimes internet is also not good and there's not as much social programming. So that's one option. Let me also just make a quick pitch for the A&O Be a Santa to a Senior program, which has this year also moved online. So this is a program where older adults in need can indicate that they would like a hamper for Christmas. And then people in the past would go shopping, or they would get a list of for individual items that the person would like, and then people would go shopping and then deliver the hamper. This line, because of COVID, it's all gone online. So you can now be a Santa by going online at beasantatoasenior.com. And if you would like to check that out, that would be great. So then when you buy online items, they then get it delivered to the person that has requested a hamper. All right, I'm at the bottom of my list here. The last point I wanted to make has to do with psychological factors or mental health problems. Again, we need a different solution for people who have those issues. One area that one can work on, and A&O has had programming around that as well, is around changing people's maladaptive perceptions, social perceptions, things like, oh, they won't like me, or I won't fit in, or I can't do that. So kind of working on those psychological factors that may hinder people from joining activities. And then some people we recognize do have mental health problems or have major other problems like marital problems, and that will require counseling. So much more one-on-one issues. So bottom line is, one size simply does not fit all. Let me just briefly go to the issue, the challenge that we have is, how do we reach socially isolated or lonely people? And in the UK, there's an End Loneliness campaign going on. They refer to those people as the hidden citizens, because by definition, the socially isolated are socially isolated. They're not coming out. So how are we going to identify those people? And this is my part of the project, this larger collective impact project, aside from the evaluation component, which I'm also leading. But this project tries to involve gatekeepers. Now, when I say gatekeepers, that's kind of it's a bad term. It's used in the literature because a gatekeeper, you think of that somebody who closes the door. Well, in this case, it's somebody who opens the door. So who are the people in the community that have regular contact with people who might be socially isolated? Perhaps the pharmacist, perhaps somebody in the bank, perhaps somebody at the grocery store. So they've been referred to as the eyes and ears in the community. So what if we could train these, and this has been tried in other places, what if these community gatekeepers could be trained to recognize socially isolated individuals or lonely individuals, and could then refer them to a referral line, and there would be somebody at the other end who would then assess the needs, connect them to resources that meet those needs, and then the person could be connected to community organizations. And that may be as simple as connecting them with an active living center for older adults, or it might be connecting them with counseling services, whatever would be most appropriate. And hopefully that could then reduce the social isolation and loneliness that we see. Now, we are just starting this project, so this is a work very much in progress, and we're just trying to explore how we might be able to do this. And of course, this project also means we need to engage these potential gatekeepers. They need to be on board. We need to have some type of the referral line. But at the other end, we need to have those organizations that then can take on people who are referred to them and are welcoming and take them on board. So I'm almost at the end, so I have just a few final thoughts. A big one is, what will or should the new normal look like? And will we ever go back to normal? There have been some good things coming out of COVID. Some of the online opportunities that have become possible have, I think, been very beneficial for those people who, for example, are homebound, so cannot go outside, who have disabilities. So bringing that programming into people's homes, I think, has been very beneficial. So I'm hoping some of this will stay. On the other hand, I'm a strong believer that everybody, as human beings, that we do need some in-person contact. And what that will look like is going to be difficult to say, as we currently are right in a code red situation. So we shall see. A big question is, how do we balance risks for us and for others? So I've just told you about the negative consequences of social isolation and loneliness, yet we are in a social distancing time. So how do we balance people's need to be with other people against the risks that COVID poses, and it poses especially for older adults with many health problems? So exactly those most vulnerable already are also then vulnerable to become socially isolated, which, as I said, is also not good. So if you have any thoughts on that, I'd be happy to hear them. And with that, I will end my presentation.
Thank you very much, Dr. Menec. That was very interesting. We do have a few questions that have come through. I encourage everyone to please go to Slido and to VL04 to add their questions. So this topic, as you were sharing, is very timely in the situation that we're in. So the question that we have here is, should an habitual self-isolated individual see the pandemic as an opportunity and not seek a return to pre-pandemic society?
I think there's the pandemic has given some opportunities. First of all, I think it has made more people aware of social isolation than ever. We're seeing it everywhere that it's an issue. I think for those socially isolated, it has been, for some of them, it has been good. For a certain group of people, I mean, good. Okay, I'm putting that in quotation marks, right? It's not good. It's not a good situation. But I think that the online activity that has been happening, so much has been moved online. I think that has given certain advantages, and which is why I do hope that some of the programming will stay. just thinking actually of the Be a Santa program, that's moved online very quickly. And I hope some of that will stay. I hope some of these learning environments will stay. That will help socially isolated people. So yeah, it can probably be seen as in a way an opportunity.
And I'm so glad that you shared programs like that, like Be a Santa to a Senior. I think that's wonderful. And I hope some of our listeners, our viewers today, many being in Winnipeg, but others being in other parts of the world, I hope there's similar sorts of programs. And I would assume that you probably encourage, because my question would be, what else can we be doing, in terms of, whether we're an introverted or extroverted person, what is it that we can be doing in terms of, helping people in particular who are perhaps more likely to feel more isolated or do not have the networks that some people do, in terms of, what is it that we can be doing? And so I'm definitely going to check out that program. But other thoughts in terms of what should we be doing?
Pick up the phone. Pick up the phone. Call your grandmother, call your niece, whatever. Pick up the phone. Online. You can do it online, but not everybody is online.
Right.
If there's opportunities to give computer technology, and a number of organizations have done that. They have bought tablets and given those to older people. And that is again, great. Keeping in mind that internet also costs. So if you were to do that, that has to be included. Or giving a phone to somebody, like a smartphone. Maybe they just have a landline, and then include the plan and then connect with people. So I think the online has been able to compensate for a lot of our deficits. The real question is, for how long can we keep that up with really truly missing that in person? That I think we do need. And some groups, of course, have kept that going as well, but smaller groups. Now we're back in Code Red, so it's changed a little bit again. But for a while there, programming was just smaller groups, and I think that is really, really important.
Mm-hmm. No, I'm glad that you mentioned that in terms of, online is great, but it not everybody has access to that. And there certainly are things, and picking up the phone is a good, easy one. You're right. Dr. Menec, we have a few more questions to come through. One of which is, some of the solutions are simply not good enough. For instance, there are really no friendly online solutions. My 98-year-old mom simply cannot navigate this alone. That's a really interesting point.
Oh, it is so true. Absolutely. And it's no one solution, right? I mean, that's my point. There's just no one solution, and I'm giving a broad brushstroke, but it so much comes down to individual needs and contexts and situations. So yes, I fully agree with you, and I get your criticism of what I've said. It will not work for everybody. So it means understanding who one is dealing with, to make sure that the solution fits the needs. So technology is the big thing, because we are supposed to socially distance, and especially if we're talking about a 98-year-old, there's certain risks too, right? And especially in the person is in a nursing home, but even there are risks. There's the balancing the risks. So maybe technology is not the idea. Is it the phone, the programming over the phone? The Senior Center Without Walls, I can tell you, was introduced in 2009 specifically to target socially isolated people. It uses the phone as a low-tech solution. Is that for everybody? No, it is not. It's not going to meet the needs for everybody. Absolutely. I don't have a solution, but I absolutely agree with you. It's not going to be one solution for everybody.
Mm-hmm. Just as a follow-up, even telephones are an issue for people that are hearing limited, which is also a great point too.
Hearing issue, and you know what? The hearing issue, and I didn't not mention that, but that is also, it's a big issue. And the masks. masks and hearing issues, right? It gets even harder when you have hearing problems. But yes, the phone, there are adaptations you can have, but they will not work for everybody. Again, not every solution will work for everybody, and not everybody has the same needs.
Mm-hmm. When things are back to normal, and whatever that sort of normal is, what are you what are you predicting, or what are you thinking is going to be happening in terms of, especially with our older members of the community, in terms of how those connections will continue? Do you think that there'll still always be like a strong virtual connection, that, or do you see things changing in the way of people are connecting in person? What do you think those changes might be?
I think some of the online activity will stay. Maybe that's my hope. I think some of the great programming that has been introduced, but I think people need people. I think there's going to be that push to get back in person. What that's going to look like, I don't know. Depends, of course, where we're going to be at. Are we going to go back to smaller groups for quite some time, or are we going to have larger groups again? I think the technology is here to stay, and I've just seen so much movement towards getting even the computer technology to older people who haven't had that. Again, realizing it's not necessarily for everybody. And you need to have somebody there also to help out. Ideally, you'd have some grandchild or great-grandchild there who could help out and with that. I know when my father went online, it was not easy. It was not easy, and at some point he could not deal with it anymore. And that was too bad. And then what are the solutions if you don't have in-person? Hopefully by then we're going to have in-person contact again in some form or the other.
Another question and comment has come through, and that is faith-based organizations used to offer in-person visits for individuals who are unable to leave their home. Are there any other similar services offered that you may know of?
In person. Well, there were a number of organizations that started up again with in-person programming. Active living centers started up again, some of them. Some of it was stopped and then opened up again. So some of that started up again in some cases. So I would check out active living. So the formerly known senior centers. So the 55 plus active living centers, they've got great programming, and too many people say, wow, they're only for older people, old people, those old people, we don't want to participate, but they've got good programming for sure. Some of those have started, let me see, I'm just blanking, but there were a number of organizations that opened up again. Alzheimer's Society had some of it going again in person. However, now we're back in Code Red. So it'll be interesting, and anybody's guess as to how quickly we're going to come out of Code Red again, and then that some of that will happen again, some of that in person.
Thank you. So I just a reminder to encourage people to ask questions, but I have a question that I've been thinking about this whole time, and that is, Dr. Menec, you and I were talking before we joined this call, and you were asking if this is in person or if it was been virtual, and I mentioned that this program evolved from our Seniors Learning for Life program, which is an in-person program, which obviously we're not able to host until further notice, and so we're lucky we've been able to turn this into a virtual opportunity. But I throw it out to you as an expert in this field. I mean, we have this program, and, we have other things that we've launched as well, but I would love to know from you, what should we be doing, from an alumni relations perspective? What are things that we could be doing, or my team and we could be doing a better job of in terms of those check-ins, knowing that we have 148,000 alumni living in 140 countries around the world, most of them obviously in Winnipeg, Manitoba, Canada, but would appreciate what really throw anything at us. I mean, we would love to know what we could do more of to do a better job of.
Oh gosh, that's a tough question. Better promotion, may I say, as an alumnus. I don't know how well known it is. I think keeping some of this online programming going, I think, is a great idea, and that has been an advantage in many contexts. And now I'm speaking kind of outside the more at-risk older adults, but it's been great to have people participate from so many different places, not just in Winnipeg. Also even just thinking of rural Manitoba, rural areas, which are not all of them have good internet, some of them do. Bringing other people in that would be really happy to participate in some of this programming. So that's all I can think of off the top of my head. Sorry.
And I throw it out there to also our members, if there's other things we can be doing, please tell us. We'd love to know. Another question came in, and that is, do you need any subjects to participate in your projects? And if so, how do we get a hold of you?
Well, the Canadian Longitudinal Study on Aging, which I've mentioned a few times, that one is you can no longer participate. That was the recruitment is closed. Well, closed quite a while ago. So that was a random sample. So that's closed. Our study we did in June, we did that at that time, and we haven't really thought about doing anything else at this point, just because time is short. Haven't had the opportunity. So right now, I have to say, from my perspective, there isn't anything happening. I would suggest, if you're interested, to get on the Center on Aging mailing list, and their regular newsletter has opportunities for research participation. So when researchers are looking for people to recruit into their studies, they often post in that newsletter. So that might be an opportunity. So that's University of Manitoba Center on Aging.
Okay, wonderful. Those are all great ideas. So with that, I just put it out there one more time. If anybody has a question, we only have a few minutes left, but I don't see anything in there. Before we conclude, Dr. Menec, are there any last final comments you wanted to share with us on what more we can be doing and to take care of ourselves and others?
I was going to end with a slide that I ended up taking out, but it's the idea of let no one be alone. That Brenda Tunn, who lives in rural Manitoba, started to promote and has been picked up by other organizations. And the idea is very simple: to look out for neighbors, other people around that might be socially isolated. So that elderly person down the street who you see the snow hasn't been shoveled, and there's maybe mail piling up, to look out for those people and let no one be alone, so that the onus becomes also on us as individuals to reach out, rather than, and I've kind of emphasized that perhaps a little too much, that people need to reach in. So we need to reach out and to encourage people, or even just chatting with people.
Very, very good advice. Thank you so much for that. So with that, there are no other questions. So thank you very much, Dr. Menec, for a very interesting, engaging presentation. Lots of, all of us, no matter our age, can take that away with us, especially during these very unique times. And I thank everybody who's joined us in today's session for participating. As I mentioned earlier at the beginning, we will be sending you a link to today's session. as well as a survey where you can share your thoughts and feedback. Now, actually, we have included a link to the survey right there in YouTube. So if you're there, you can see the link and you can just answer it right now, or we will also be following up with the survey as well as a link to today's session. I encourage you to please respond to that survey. It won't take you very long, but it's the only way that we're able to gather feedback and for us to improve. So I encourage you, so we have a week off next week, with it being a break here in the academic schedule at the University of Manitoba. So please join us in 2 weeks when we will hear from Dr. Keith Folk on the topic of research on preventing infectious diseases, studies from HIV and COVID-19. So thank you again for spending the last hour with us, and we will see you again in 2 weeks. Thank you.